Laurocerases. Cerases Laurocerases అంటారు. Common laurel, Prunus Laurocerases, Cherry laurel, Rosaceae అండి. గులాబీలో రకం. Instead of young leaves, dilutions of aqua Lauroceraceae. Laurocerases, the so-called laurel of our gardens, is not a member of the Lauraceae. Though the male laurel, Laurocerases Lauraceae loki radattunnadu, Rosaceae loki vachindi. Laurus nobilis is the aqua Lauroceraceae prepared by distilling the fresh leaves, contains hydrocyanic acid and is supposed to owe all its medicinal virtue to this fact. Milne says it is used in spasmodic cough and in phthisis, but it is better to employ in prussic acid itself. In the poisoning cases that have occurred, the symptoms have been practically identical with those of the persons poisoned with the prussic acid, but the proving brings out more delicate shades of action and fully entitle the remedy to an individual place of its own. Coldness, blueness, epileptiform convulsions are common to both. Both have a dry and tickling cough, but Laurocerases has a cough with jelly-like expectoration dotted with bloody points. Laurocerases has cyanosis both of the newborn infant and of heart disease. A peculiar gasping is indicative here, gasping without really breathing. In addition to the blueness, there is a twitching of the muscles of the face, which is also an indication for Laurocerases in Korea. Clubbing of fingers, which is a common feature in cyanosis and phthisis, is a characteristic of Laurocerases. Lack of reactive power, low vitality is another keynote of Laurocerases. This is particularly so when occurring in chest infections. Long-lasting faints, camphor has sudden faintings. Seems to have no reactive power. Face pale blue, surface cold. Prostrate before getting up in morning and difficulty in opening eyes. Attacks of indigestion and pains across lower abdomen, which come suddenly in the morning and generally disappear on getting up. Gnawing pain in lower abdomen going on for years in old men with occasional looseness of stool. If fluids are forced down the throat, they roll audibly into the stomach. When indicated in eruptive fevers, the eruption is livid after pressure with the finger. The skin is long in regaining its color. There are suffocative spells about the heart aggravated by sitting up. The patient is compelled to lie down as it's sworn. Though some heart symptoms have the opposite condition and compel the patient to sit up. E.V.M.Acharya gives these rearing symptoms. Gasping for breath, the patient puts his hand to the heart as if there was some trouble there. This may result from running a short distance, which puts him completely out of breath. Going upstairs, walking or any exercise may bring the gasping on. Coldness is a common sensation, internal coldness and external heat. Cold tongue, heat of single parts. Warmth on center of forehead, then a coldness as from a draught of air lasting a long time. The left chest is most affected. There is aggravation before eating, constricted sensations in gullet, in rectum. There are some very noteworthy uterine symptoms of menorrhagia and dysmenorrhea in the provings, and the value of them has been emphasized by cases related by Cooper in his work on cancer and cancer symptoms. The leading indications according to Cooper are A sense of fatigue pervades the whole system with a very painful condition and of the heart and indurated tissue of the parts affected. Pain much ameliorated by sleep. Tendency to oozing of blood, which is generally bright and mixed gelatinous clots. This applies to chest as well as to uterine and rectal symptoms. Only the blood comes painlessly into the mouth, but with great pain for vaginum. In most cases, it will be found that the pains it relieves are such as start from the lower part of the spine and extend either round the pelvis or up the head, and are accompanied with a sense of suffocation and a sick feeling with drowsiness and a great desire to sleep that generally brings relief. In cases that are sleepless, the desire for sleep is very great. Digestion is weak, bowels confined, patient low-spirited and with flatulence and burning in the chest after food. Constant tired, sick feeling, entire frame enfeebled, inclined to lose loss of flesh, and hemorrhages that are small in quantity and bright in color. The flatus is audible and gurgling and rolls about the upper abdomen. In nervous affections, constant jerks, constant keep still, and the characteristic gasping are the leading indications. Peculiar sensations are coolness of forehead as from draught of air, weight on top of head as if brain loose and falling into forehead when stooping, as if a heavy lump falling from abdomen to small of back, as if a wheel before eyes, as if nose stopped, as if flies and spiders crawling over skin, as if tongue, mouth, throat were burnt, as if abscess in region of liver would burst, as if lungs could not be sufficiently expanded, as if lungs pressed against the spine, as if mucous membranes were dry. Stitches are very prominent. Also stiffness and pressure, especially pressed upward. Ellen's indications are an extremely nervous, excitable condition accompanying ailments. Diarrhea as of green mucus with suffocating spells about heart. Dry, harassing cough of phthisis. Spasmodic cough of later stages of whooping cough when patient is much prostrated and has nervous spasmodic symptoms. Cough with valvular heart disease. Cough incessant, especially on lying down. Fluttering in heart and gasping with cough. Alternation of chill, fever and sweat in phthisis. E.V.M.Acharya relates the case of May S. 7, who had been troubled sometime with an almost incessant cough for which many remedies were given without benefit. At last, E.V.M.Acharya came to the conclusion that Laurocerases was the remedy and put 10 drops of the 200 into 5 tablespoons of water, ordering a teaspoon of this to be taken every 2 hours when the child was awake. This was at 4 p.m. After the third dose, she fell asleep. At 3 a.m., she awoke with a very excited condition. Her mother asked her if she had not been dreaming, but her tongue was so stiff she could not answer. Suddenly, she began to tremble all over as if in chill. After 10 minutes, she began to twitch and jerk. E.V.M.Acharya was sent for and found her in this convulsed state. She could not articulate for the thickness and heaviness of the tongue. The mind was clear. Recognizing the action of Laurocerases, E.V.M.Acharya antidoted it with camphor and later a cup of coffee, and she came all right in a few hours. And it was a She had no more of the cough. Many symptoms are ameliorated by sitting up. Cough continuously when lying down. Bending head forward ameliorates pressure in neck. Compelled to bend forward by contractive pain in groin. On the other hand, suffocating spells about heart compel him to lie down. When she attempts to rise from recumbent posture, sensation of heavy lump falling from pit of the stomach to back. Stooping aggravates, sitting aggravates gasping. Causes feet to go to sleep. Crossing of legs causes feet to go to sleep. Motion aggravates cough, causes gasping. After dinner, hunger, irresistible drowsiness. aggravated evening and night. Coldness in forehead and vertex is ameliorated in open air. Vertigo and pressure in nape are aggravated. External warmth does not ameliorate coldness. Approaching stove causes nausea, cold. Being touched by water causes burning between fingers. Causation, fright. భయం వల్ల కూడా ఒక్కసారి సిమ్టమ్స్ వచ్చినా కూడా లారోసెరాసిస్.